Crossroads Animal Hospital, located in Seneca, South Carolina, is a full-service veterinary hospital for small and large animals established by Dr. Kathy Jordan. Crossroads also provides 24/7 emergency services for clients. I began working here back in August 2013 with the goal of gaining experience for vet school. As I progressed from kennel assistant to emergency vet assistant over the past year, I gained so much more. I've learned about veterinary medicine, the business aspects behind a clinic, and strengthened my desire to become a vet. Thanks to Dr. Jordan and the rest of the staff, including our blood donor dog and cat, King and Casey, I was able to overcome many challenges and stressful situations that made the experience so worth it. At the end of a long workday, I was always amazed by how much we got accomplished as a team and how much new information I had learned that day. It was never boring at Crossroads, as we always had something new and interesting to tackle. On a typical weekday morning, we perform routine surgeries such as spays and neuters. Vet techs and assistants like me are responsible for getting everything ready. First, I have to set up the surgery room as seen here. Blood work is optional for clients, but we recommend blood work before putting any animal under anesthesia, just to make sure they don't have any underlying problems. I learned how to properly restrain dogs and cats for blood draws, and I also got to practice drawing blood from the saphenous vein, the vein in the leg of dogs. This here is a jugular stick, which is used to get a larger volume of blood. Once collected, we use two machines to analyze the blood. The first machine does a complete CBC, while the second one does briefer chemistry profiles. These are used to check to see if the internal organs are functioning properly. I would eventually like to learn how to interpret the results better. We also prepare a hemocrit, or PCV, to determine the packed cell volume, as shown here. If the blood work checks out good, we can begin preparing for surgery by setting up for an IV catheter. I was responsible for getting the necessary materials and restraining the animal. I never actually got to place a catheter myself, but after seeing so many done, I know the steps of how to do it. Once the animal is ready and Dr. Jordan has done her exam, we give the animal the first dose of drugs to knock it out. An endotracheal tube is placed to keep the trachea open so the animal can breathe while under anesthesia. The surgery site is then prepped by clipping and cleaning with surgical scrub. It is very important to maintain sterility, so the surgery pack must be opened very carefully to ensure that none of the surgical instruments become contaminated. During the procedure, I have one of the most important responsibilities: monitoring anesthesia. This includes monitoring the animal's heart rate, respiratory rate, oxygen saturation, and blood pressure. Machines measure these values, but I am responsible for ensuring that the vitals are within normal ranges. I also have to check the gums to make sure they aren't white, indicating dehydration or blood loss. And I check the animal's eyes to make sure it isn't starting to wake up or get too deep under anesthesia. All of these parameters must be recorded every 5 minutes throughout the surgery. When surgery is completed and after the animal wakes up and is in recovery, I help clean up the surgery room and wash the instruments. I also learned how to operate the autoclave, which is used to sterilize the surgery packs. Weekday afternoons and Saturday mornings typically consist of appointments. These usually involved puppy-kitten visits, yearlies for older animals, and diagnostics for sick pets. I got to see a variety of animals, including puppies, kittens, dogs, cats, horses, cattle, goats, rabbits, hamsters, and even reptiles, such as this turtle. One of my favorite things to do was take x-rays. During my time at Crossroads, we have upgraded to digital imaging, which is much easier and much more efficient than having to develop x-rays using chemicals in a dark room. The x-ray process starts with setting up the machine and then measuring the animal to enter correct values. The animal is then positioned on the table, and the simple push of a button takes the image. Images appear on the computer within minutes. I was always fascinated with what we found in x-rays. We once had a cat that had at least 10 bullets under its skin. Other diagnostic tools included fecal examinations, which checked for internal parasites. We did these quite frequently, and I learned how to look for parasite eggs under the microscope. We also did a lot of heartworm tests, and unfortunately would sometimes see positive results. I even learned how to collect urine samples and how to do urinalyses. And I also learned how to prepare other types of slides to look under the microscope, such as blood smears and ear swabs that both need to be stained, as shown. Routine care involves annual checkups, vaccines, and heartworm prevention. Vaccines are very important, especially for young animals, and we administer several vaccines every day. I also had to help educate clients about the importance of heartworm prevention and flea medication, and inform them of the different types available. We have many medications at the clinic, and I was responsible for filling prescriptions and drawing up injectable drugs when needed. Crossroads Animal Hospital also has a non-profit rescue organization associated with the clinic called CARE. These are just a few of the care animals I have had the privilege of interacting with. The staff at Crossroads also likes to have fun. We had a staff meeting on Lake Hartwell one day, and even took a staff trip to go kayaking at the beginning of the semester. Most recently, I attended a Halloween event hosted to benefit CARE, and all the adoptable animals were dressed up in costumes. Here is Banjo as a skeleton. Overall, my experience at Crossroads Animal Hospital has been nothing short of great. I truly enjoy working with Dr. Jordan and all of my coworkers. They have taught me so much over the past year. I am fortunate that I was able to start out my career in the veterinary field at such an excellent clinic.